Mike, why don't you come? Mike, why don't you come over here? Do I have everybody? All right, why don't we get started? Look, we're honored to have our county partners with us today. And we have Commissioner Rydell of Precinct 1, and we have Commissioner Adrian Garcia, Precinct 2. The county judge will be, that's the county judge right there, virtually. How you doing, Judge? Congratulations, negative. Yeah. And then I have council members, Mayor Pro Tem Dave Martin, Councilmember David Robinson, Councilmember Edward Pollard, Chief Pena is also present with us today as well. All right, let me say good afternoon, and let me thank everyone for being here, and I certainly want to welcome our partners from Harris County Commissioners Court. Today we are going to focus on two important topics, both are related to COVID-19 and the impact of the pandemic that the pandemic is having on the city of Houston and Harris County. We're going to first start with the homeless initiative. We'll discuss today's testing results secondarily. Over the years, the city of Houston and Harris County, we have struggled with the challenge of reducing homelessness. As the city densifies, those who are sleeping on our streets become more noticeable, and that has been amplified during the pandemic. Houston is a model city for addressing the homeless population, but we must do more. In fact, we all recognize we must do more, and no one entity can address it effectively alone. It takes everyone working together, and everyone must play a part. At the beginning of the year, when I took the oath of office for the second term, I identified homelessness as a priority. I called on private businesses and nonprofit organizations to contribute to solving the challenge. I said we needed an additional $50 million to decrease the city's homeless population by 4,000 by the end of 2021, and that they need housing with supportive and wraparound services. Today, we stand before you, both the city and the county, proudly to say that we are taking a collective step towards fulfilling the goal of reducing homelessness in our city and in our county. Together with Harris County and the private sector, the city of Houston have created a joint $65 million community-wide COVID-19 homeless housing program that would permanently house 5,000 homeless individuals in less than 2 years. I, too, want to acknowledge Mark Eichenbaum. Where's Mark? He's standing somewhere in front. I want to acknowledge Mark. Mark has been the point person for me and for the city in this effort, and I want to acknowledge Andy Eakin for also, where's Andy? And there is Andy. I want to acknowledge both of them for their work in this effort and working very closely with the county. This $65 million program is the largest, most ambitious homeless initiative in the history of the city or county. But it is not about the amount of funding, but rather the number of lives that the initiative will transform, more than doubling the number of homeless individuals that are annually housed. And I want to acknowledge Mike Nichols, who's over our Homeless Coalition partner. Mike, there he is. Mike, let me just acknowledge you from the very beginning as well. Due to underlying health conditions and a lack of access to facilities, people experiencing homelessness are especially susceptible to the coronavirus and are at a higher risk of experiencing severe symptoms. According to the CDC and HUD, it is imperative that we get our at-risk brothers and sisters off the streets and out of the shelters and keep them from filling the emergency rooms for non-crisis care. The situation is only compounded with the prospect of thousands falling into homelessness because of the economic impact of the virus. We are responding now to protect the health of an at-risk homeless individuals, prevent potential communal spread, and assist those forced into homelessness by COVID-19. The program will be under the umbrella of our regional homeless response system, the Way Home, and managed by the collaboration of the homeless. The program is divided into three major components. One, bridge to permanent supportive housing. providing long-term housing with wraparound supportive services for our most vulnerable homeless, primarily living on our streets and in our encampments. 2, rapid rehousing, providing up to a 1 year of rental assistance and case management for 1,700 individuals and families who are currently or newly homeless. And 3, diversion, providing a range of case management services, including short-term rental assistance to prevent 2,000 individuals from entering the homeless system. Make no mistake, this is an emergency response to an infectious disease, but one that will have a permanent impact by significantly decreasing our homeless population. Our annual homeless counts reveal that after substantial investment from the city and county since 2012, we had a more than 55% reduction in homelessness. However, over the past 3 years, the size of our homeless population has remained stagnant, and although it takes a lot of work to prevent our homeless population from increasing, the city and county is not interested in just maintaining the status quo. We are not interested in small incremental reductions. We want, we need, and we will achieve a significant reduction of homelessness. And although much is unknown about the long-term impact of COVID-19, I anticipate this program will help us reduce our nightly homeless population by the end of the year, with even more significant reductions thereafter. Homelessness is too big of an issue for just the city or just the county. It takes both of us working together, and I can't say enough for the county judge and the Harris County commissioners for partnering with the city. They've already, as of yesterday, approved $18 million, and I know they will speak to that. And so I'm grateful to the partnership that we have, the collaboration that we have, and I think it speaks volumes for what lies ahead. It shouldn't matter which side of the street a homeless person is living on to determine whether they qualify for a city or county assistance. The truth is that homelessness knows no geographical borders. It affects every community and requires a community-wide response. The community-wide COVID-19 homeless housing program is our response, for in Houston and Harris County, we operate under the mantra, either we go big or we go home, and then if we go home, a lot of people will remain homeless. And so today, we take a significant step at reversing that trend. Houston alone will be putting in a little over $40 million to this program, and with the private sector, along with the county, that amount will be $65 million. And we expect over a 2-year period, more than 5,000 people will be addressed. Let me turn it now over to the county judge, Lena Hidalgo, who is with us virtually and staying safe. County Judge.
Thank you so much, Mayor. It's just so wonderful to join you and my colleagues in Commissioner's Court, of course, City Council members. And I also want to acknowledge Mike Nichols and the Coalition for all of the work that you guys have done. Mayor, I think you said it right. This is a historic effort. It is an issue that does not stop at the city boundaries or at the county boundaries. And that's why this effort is so unique, because we're breaking down silos between city and county, because it's a historic investment, $18 million that Commissioner's Court passed unanimously yesterday. And because it is smart. It is a paradigm shift in the way we address homelessness. Homelessness is not an easy issue. You can't just send the police and ask them to pick up folks experiencing homelessness from the streets, and that's where it ends. You can't house somebody for 1 night or 2 nights or a week and expect that the issue will be fixed. Instead, we know that addressing homelessness in a proactive way, looking at longer term options for housing, at how we set up the folks experiencing homelessness to succeed and be able to have permanent housing, to address issues of substance use, mental health issues. That's the only way in which we can tackle homelessness. Of course, it's a difficult time. As we have this innovative approach, we all are bracing for an increase in the homeless population because of the wave of evictions that I know the city and the county have both worked very hard on, that we've been calling on our justices of the peace to help us out on, and that we continue to fight. But I trust that this will help mitigate the impact of what we see coming, and also that it represents a change in the approach in our county and in our city. This is not probably going to be a one-time solution. We're going to have to continue with this work, continue with these investments, but oftentimes the hardest thing is just to change that strategy, to identify the most strategic, smart way to address the problem. And I think we're finding it, and we're finding that we get there together. So Mayor, thank you so much for your partnership, and to my colleagues for your leadership and support on this. I think it's a proud day, and it's the beginning of a new approach. This is not a day to claim victory, but it's a new approach it will be incredibly important. And I will repeat with that briefly my remarks in Spanish. First, let me just darle las gracias al alcalde Turner, a mis colegas en la Corte de Comisionados, que hemos estado trabajando todos juntos en esta nueva estrategia, y a Mike Nichols, quien dirige la coalición para las personas sin hogar. Y es realmente esta una iniciativa innovadora. Es increíblemente importante la estrategia con la cual ataquemos este tema de la falta de vivienda. En el condado hemos ya venido innovando, en el condado, en la ciudad, pero este esfuerzo es realmente histórico. Primero, es una inversión histórica, 18 millones que ya ha otorgado o comprometido el condado el día de ayer por voto unánime. Todos los comisionados apoyaron esta inversión de 18 millones de dólares. La ciudad también, en adición, sus propios fondos. La estrategia es nueva, es creativa. Es reconocer que a las personas sin hogar no podemos simplemente que la policía los recoja, que la policía los arreste y se acabó ahí el problema. Tenemos que encontrar opciones para vivienda, que ponerlos en camino de tener una vivienda permanente, de manejar temas de salud mental, de trastornos, de uso de sustancias, y de eso se trata este programa. Sabemos que viene probablemente una ola más de personas sin hogar dada la crisis del coronavirus. Estamos todos trabajando en eso, pidiéndole a los jueces de paz que nos ayuden también para prevenir esos desalojos, pero estamos listos y seguiremos luchando. Este es el principio, no es el final, no es victoria, pero es el principio de una estrategia muy importante y marca un cambio en la manera en la cual manejamos el tema de la falta de hogar en el condado Harris y en la ciudad de Houston. Thank you, everyone. Thank you so much, Mayor, for including me here from quarantine and for your efforts from you and the City Council. Thank you.
Thank you, Judge. Before I turn to Commissioner Garcia, I did want to acknowledge to Tom McCaslin, Director of Housing and Community Development, that's also worked very closely with us on this initiative. Commissioner Garcia.
Thank you, Mayor. Judge Hidalgo, Commissioner Ellis, esteemed members of City Council, Mark Eichenbaum, point person for the City of Houston, Tom, thank you all for your partnership. You know, I have dealt with this issue on many fronts. First, as a young beat cop, seen this issue from the front seat of a patrol car. Then, as a member of Houston City Council, Mayor Pro Tem, and one important person of City Council of past that deserves some recognition, and that is Councilmember Gordon Kwan. Did an immense amount of work in his time, and so this work continues. But with the leadership at Harris County, with a renewed focus on helping those who, not for the grace of God, there go I, we are providing a strategy thanks to the leadership, the thoughtfulness by Mike Nichols, the Coalition, the Homeless, Jim Nutter from Harris County, and so many more. And another young lady that is as impressive as our county judge is Mercedes Sanchez, point person in my office that worked tirelessly on this issue. Look, folks, no one wants to drive your neighborhood and have someone try to wash your window or ask you for money. We don't want to see people in our parks. We don't like seeing them in encampments on the side of the road. We point fingers and say, too bad, or someone ought to do something about it. Well, with this incredible, historic, and you'll hear that word many times over, leadership by Mayor Turner and his staff, the partnership that Judge Hidalgo and Commissioner Ellis and myself are bringing to the table, breaking down those walls so that we can deal with an issue that, as Mayor Turner says, knows no boundary, but an issue that affects us all. And as the largest county in Texas, the county that has NASA and the Port of Houston, the community that put the first person on the moon, we have always been a can-do community, and this is an example that we will continue to do everything possible to address an issue that so many have turned a blind eye to. And so I'm so grateful. And then lastly, let me just say, this is the smart thing to do, as the judge said. It's the fiscally smart thing to do. $40,000 it will cost to leave someone on the streets or in the county jail. Because that's the system that we have to support folks. County jail or just leave them on the streets. $40,000 is what it costs, because we send the experts on homelessness, which are law enforcement officers, to deal with this. But through this collaboration, $17,000 will be the cost for those persons that we will be able to help over 2 years per person. 5,000 people. On an average, we have, 1,700 folks on the streets on any given day. And so this is an incredible paradigm shift, as our good judge has indicated. And I am just so proud. I am so proud of my colleagues. I'm proud of our city. I'm proud of our county. But I'm mostly proud of citizens like Jim Nutter, Mike Nichols, who step up, provide leadership and thought to get the job done and create history. But as we have said before, this is not the end, but rather it is a very, very specific example of phenomenal progress that can happen when you collaborate. Thank you very much.
Thanks, Commissioner. Commissioner Ellis.
Thank you, Mayor. I want to congratulate Commissioner Garcia in particular from our side on the county level. He has spearheaded this issue from the moment he got to Commissioner's Court. And of course, I want to thank Judge Hidalgo. She's the smartest one in the group because she's at home. Mayor, I want to congratulate you. And I think everything I want to say, you pointed it out. I will add that I want to thank our federal partners as well. And we are lucky to have great congressional leaders who have fought to give us this money. And Mayor, you know, the years that you and I were in the legislature, homelessness is an issue that is so difficult to focus on. During the best of times, people would say, well, we're too busy. And then during the worst of times, they'd say, we don't have the money. This is very impressive for Houston, with Nutter and the entire group, Mike, to do this now. It's important during the worst of economic times that the county and the city work together. I want to challenge our state partners. What we don't have is that big ingredient our friends out in LA had. The state of California put money in. And the challenge for us is to sustain this. Because with the federal dollars we're going to use for this, there are other things we've got to pick up the tab for. Mayor, your city, unlike us at the county, you have put local money into housing. We have never done that. And going forward, we've got to focus on it. I'll close with this. All of us in government are encouraging people right now to stay home. Just think about those people who don't have a home to stay in. And think about the numbers going up. Because in the midst of an economic challenge, that in ways will rival the Great Depression. Homelessness is a problem now, and we're going to confront it with this money. But there's a great likelihood, as you alluded to, Mayor, those numbers will go up. So I'm glad to be here. Thank you. It's a great day for our region.
Mike Nichols over the Coalition for the Homeless. Mike.
Thank you, Mayor. Thank you, Commissioner Ellis. Thank you, Commissioner Garcia, Judge Hidalgo. There's a lot of congratulations going on today, and that is well-deserved. And I have some folks to thank, but I will tell you that now the hard work begins. Now the work begins of actually housing people, putting these funds in the right pockets to make this work. And I'm going to start off with the thank yous because I represent the Coalition for the Homeless and its board of directors, and we're grateful to have Alan Watkins, our most recent board chair, and Lance Gilliam, our current board chair, with us. We also are very grateful to the Continuum of Care Steering Committee, led by Tom McCaslin, who has two roles in his Department of Housing, and in this very important role as our community's leader in setting up the vision for ending homelessness in the region. I thank again, the County Commission and the judge and the mayor and the City Council and the Department of Community, CSD Department led by Josh Stuckey and Daphne Lamel. I mean, these folks have done great work. And I want to say thank you because I stand here representing the 30 employees at the coalition led by Jessica Preham, Anna Roush, and Sarah Martinez, who have really worked day in, day out to help build this plan, and now are going to help lead this to be the most effective plan in the nation as we house 5,000 folks and put them in a place where we will make homelessness rare, brief, and non-reoccurring. I want to reiterate again what Commissioner Garcia said about fiscal responsibility. We know it costs in excess of $40,000 when a person stays on the street. Most of these funds are on the weight of the county and the city, particularly the health department and the criminal justice system. When we house these people, again, those funds will be not needed, and folks will be in the right place to get good health. And again, during COVID, what did we find? We found that housing is health care. We found that when we said, please stay home, if you didn't have a home, you were not going to have the kind of health care you needed. I want to add two other points that I think are important. One is we will need the participation of private philanthropy, who've always done a great job standing with us, to help us fill those gaps that these funds cannot fill, especially with landlord incentives and especially in making sure we have kits for folks to move in so they're not moving into an empty home. The second is we'll need help from Houston and Harris County's landlords. They need to step up and help us house these people and realize that with this funding, they're going to have good clients, good residents with the right support services. Finally, there has been some changes in the budgeting. This is a complex process. The budget has moved from $56 million that was originally discussed to $65 million, and that budget has been updated to reflect the additional ESG funds that will help our clients make sure that they have the best services available to help them stay housed and to make sure that those clients that even need more services can have those additional services. I also want to thank the great folks at Harris Center who are working and partnering with us to add this important psychological and healthcare services that these folks need. Again, I'm thankful to so many people to making this happen. It's going to be a terrific 2 years. We're going to watch the results. We will be held accountable for those results. Thanks so much.
Thanks, Mike. Let me call on Mark Eichenbaum, Special Advisor to the Mayor on Homelessness.
Thank you, Mayor. This is truly a moonshot for the city, for the county, and for our homeless system. You know, from the day one where the mayor took office, he constantly said we must move the needle when it comes to homelessness. And this is that project with the city and the county standing side by side that's going to move that needle. The three main components that the mayor spoke of, each one has a different level of support services that is tied to the different types of assistance. They are specifically tailored to the needs and the levels of vulnerabilities of the clients that it will serve. We are using data-proven interventions here. Not proven nationally, but proven locally. Through the housing that's already happened, more than close to 90% of the individuals, the homeless individuals that are on the streets that we are housing on a daily basis, stay housed 2 years later. It is a very complicated process, to say the least. We have 11 different buckets of funding from 6 different sources, from 4 different entities, all with different requirements and eligibility guidelines. It's really been the task of the Coalition for the Homeless, working with the city's housing department and with the county to figure it out, and I really thank all the entities involved. This is an emergency response that will pay off long-term dividends. And this is truly taking a crisis and turning it into an opportunity. This is a 2-year program, but the majority of individuals will be housed in the very first year. $65 million, 5,000 individuals practically being housed in just 1 year. This is setting a new national standard, and truly the entire country is watching what's being done here in Houston and Harris County. I greatly appreciate the mayor's leadership on this. I greatly appreciate Judge Hidalgo, Commissioner Ellis, especially Commissioner Garcia for introducing this at Commissioner's Court. I really thank all the county and all the 100 different agencies of the Way Home, our homeless response system, that will be working to make this happen. As Mike said, we need landlords, we need management companies. If you're interested in being part of this program, please contact the Coalition for the Homeless. And lastly, we still need to raise the final $6.5 million from private sources. So please, community philanthropy, we want you to step up and join as partners the city and the county, because only together can we make this happen. Thanks again very much for everybody's support, and especially the council members who have already supported one item and anticipate their support on all the contracts to come through. Thank you.
Thanks, Mark, and I certainly do want to acknowledge the council members, because without their support, this doesn't happen. And since we are committing to over $40 million and it requires council support, you know, I love each and every one of them so very, very much. So let me thank you. At the same time, I do want to emphasize what has been said, and that is the private philanthropy. These dollars, $18 million from the county, $40 million coming from the city, but there is a tremendous role for private philanthropy, for businesses and others to chip in so that we can do even more for the number of people who will be homeless. So it doesn't mean that people, you know, you talk about 5,000, but there's still every day that there are people who are falling through the cracks, and we need to make sure we do everything we can to address that. Okay, so we're here for any questions as relates to the homeless initiative. Any questions that we have not answered on the homeless initiative?
Where did the private donations go to the Coalition for Homeless, or where would those donations?
Mike, you want to come? And Mark, both of y'all can go.
Yes, we have a fund established for this particular plan, and it will go through the coalition. We will have a restricted fund set up for philanthropy to make sure those funds are used toward this goal of housing 5,000 people. Mark, do you have any additional?
And my hope would be that we can match what the county and the city are given collectively. That's about $60 million. We can get a match of dollar for dollar, $60 million from the private sector. That would even do even better. Okay?
Question. Homelessness is a multifactorial issue. So when we talk about homeless, we are thinking about sustainability and the people staying in the home or retention. Let's take drug addiction as a contributing factor, abuse, domestic abuse, mental health issues, and related things. A lot of homeless people also look at homelessness as a lifestyle. So we have the situation of people transitioning out of the prison system, and they are coming out there. Are we going to help them with these funds? When we get people who are going to be helped through the Coalition for the Homeless, a lot of your work is done through shelters. How much of this money is going to go into that? How much of it do we think is going to go into administration and related issues? But the emphasis is, how do we really let people who look at homelessness as a lifestyle really not coming out of those homes back to their normal lifestyle? Thank you.
So there's lots of different causes for individuals falling into homelessness. But what we know is that most people do not choose the lifestyle, as you put it, of being homeless. It's incorrect. Most individuals, it's a loss of income, which is the reasons. And we do find significant behavioral health issues among the population. What we found is that individuals on the streets, many of them do not want to go to shelter. That's why they're on the streets. But when we come to offering them supportive housing with wraparound supportive services to keep them housed, 99% of them accept that. And that's why we are so focused on housing individuals permanently, so that they're not rotating back into the emergency rooms and back onto the streets, back into the emergency rooms, into a shelter, into a jail, back to the streets. We want to break that cycle, and we do that by housing. Once again, close to 90% of all the individuals we have permanently housed have stayed housed 2 years later. And these are very vulnerable people suffering from severe mental health and substance abuse issues. While they are housed, they are provided wraparound supportive services. This is mental health, and this also includes supportive service assistance, substance abuse counseling as well. When it comes to how much is going to the shelters, shelters play a key component because they are the front door into our housing system. But shelters by themselves are not an answer to homelessness. And that's why all the dollars in this program is going to permanently housing individuals. It's not going to more shelters. It's not going to just managing the issue of homelessness. It's going directly to case management, to rent, to supportive services, to get these people permanently off the streets.
Mark has stated it very well. Our homelessness, as you said, is the proof of some failed systems. You mentioned criminal enforcement, criminal justice. I challenge the state of Texas that when folks get out of state prison, that they come out with good IDs and good ways to figure out where to have a place to live. We need to continue to work on that. With mental health, clearly, and substance addiction, clearly we have work to do. But again, Mark has stated it very well. When we see people and offer them homes, it is the first step to ending the trauma-filled life that they have. And they begin to move forward with those lives. So again, your questions are good. We have policy changes that have to be made. We know this program will work because when you house people, they then move forward in dealing with the mental health issues, the substance addiction issues, and other issues that are faced. Now, there are some significant poverty issues that we face across this county and across the nation that we do have to deal with. This is about those folks who have fallen into homelessness. One of the issues that you're going to see is a diversion program that will sit at the entrance of our shelters to try to get people to find ways that they don't begin to fall in the homelessness system, and that'll be an important part of this. Administratively, this is literally pennies on the dollars. It is not an administratively heavy program. The funds go to the service providers, the rent, and to help these individuals stay in their housing.
Okay, let me thank you all so very much. We're going to segue into the second half. Let me thank again the county judge, the county commissioners. Appreciate the partnership. Look forward to working with you all on some other projects. Okay, Chief Pena, will you come on up? Council members, you all can stay. Okay. Director White, Chief Pena. Okay, the Houston Health Department today reports 832 new cases of COVID-19. That's 832 new cases today, bringing Houston's total count to 21,123. The number of deaths increased by 4, and that now stands at 228. So 832 new cases, COVID-19. We're adding 4 more to the number of people who have died as a result, so that brings the number to 228. Let me just briefly highlight those 4. Again, it's a black female in her 60s with underlying health conditions, a Hispanic male in his 70s, also with underlying health conditions, an Hispanic male in his 50s with underlying health conditions, and I want to highlight this particular person. This is a Hispanic female in her 20s. With no known underlying health conditions, who passed away on June the 11th. And so I just want to remind people as we move forward, especially with the 4th of July weekend that's coming forward, that this virus is still very much prevalent within our community, and we're needing everyone to do everything they can to slow the progression. You know, yesterday we announced 280. And that number was much lower than what we had been announcing over the last 10 days. And so one could think, okay, maybe we are turning the corner, but today we're announcing 832. So it lets you see the volatility to some degree within this, in the numbers that we are reporting. But just to highlight the fact that this is an equal opportunity abuser, doesn't matter what your age is. Today we're reporting a female in her 20s with no underlying health conditions that passed away as a result of this virus. Of these 228 people who have died, 64 of that number are associated with our nursing homes, and 3 are associated with our county jail, and that number hasn't changed in quite some time. The threat of COVID-19 poses to our community right now is higher than it has been. There is a severe and uncontrolled spread between our families, friends, and communities, and it's going to take all of us working together to arrest the speed of this virus. Testing, contact tracing, and hospital capacity are all strained, and we need to slow it down so that it doesn't overwhelm our healthcare delivery system. And in order to do that, let me encourage again, in the strongest of terms, everyone to wear their masks, maintain social distancing, wash your hands, and remember that people who don't know that they are infected, people who are asymptomatic, can still spread this disease to other people as well. The numbers are continuing to surge, and according to published reports, Tuesday marked the highest single-day increase in COVID-19 cases for the state of Texas to date, with more than 7,000 new cases reported. And so we have a chance to regain some degree of control over this virus. The next 2 weeks are going to be critical, and what takes place over the weekend will be even more important. I can't stress the importance. And during the Memorial Day weekend, people came together, went to the beaches, started hanging out, going to various parties, and then after that, the numbers started going up. This is another extended weekend that we are approaching. I encourage everyone as much as possible to maintain your physical distance. Okay, to maintain your physical distance. Don't be rushing down to the beaches and all of that. Don't be having big parties and celebrations coming together. The best way that you can show your love and appreciation and respect for somebody right now is to maintain some physical distance. The 4th of July celebration this year for us will be a virtual one. So there won't be any festivals or things downtown in Eleanor Tinsley Park. There will be a virtual celebration. I want to encourage you to watch it on the television. Same thing, there'll be some fireworks, but I would encourage you to watch it at a distance, but there won't be a gathering in Eleanor Park. So we remember, as we celebrate freedom this holiday, Lady Liberty wants you to wear a mask with a smile, okay? And so please do that, and then keep yourself healthy. Now let me pause and bring up Chief Pena for a report he may have.
Thank you, Mayor. Well, I wish I had some good news, but the numbers for the fire department do not look good as far as staffing and people in quarantine. We are over 260 firefighters in quarantine as of today. That's been over a 200% increase from just a few weeks ago. And we have 66 firefighters that are currently positive with coronavirus. Over the course of the operation, we've had 127 that have contracted the virus. 61 of those have come back to work, but we still have 66 of those out. The first line of defense, as far as public safety, we're being attacked really on several fronts, not only in the patients that we serve each and every day, but also off duty. As the mayor mentioned, our family members, our relatives, our friends, our acquaintances. As the virus penetrates into the community and more people are exposed, our firefighters are being exposed off duty as well. And we're having to follow CDC guidelines in our quarantine procedures. That is having a significant impact on our ability to keep firefighters on duty. And with the 4th of July coming up, my concern is that we're going to be stretched extremely, extremely thin as far as staffing. So again, every day we come up here and every day we stress the importance and the small things that we can do as a community to ensure that we are blunting the progression of this virus. Wearing of the masks, proper hygiene, and physical distancing. It's the mantra. We say it day in and day out, but that is the only way that we're going to be able to get ahead of this, stop the progression, and help this community in maintaining public safety. I don't have the PD's numbers, Mayor, so that's the end of my report. Thank you.
Thanks, Chief Pena. And we call on Steve Wright, who's head of Parks and Rec, for any announcements he may have.
Thank you, Mayor. So as all y'all know, we've got a big holiday weekend coming up. We've got 4th of July. It's going to fall on a Saturday this year. Normally, the activity at the parks on the 4th of July falling during the week isn't that much higher than during the week. However, err to the side of caution, since it is going to fall on a Saturday, we are going to keep the parks and trails open for active recreational activity. The easiest way to remember that is just keep moving. We will be patrolling the park. We will have our park monitors back out there. If people do want to get out, you can walk, you can jog, you can wear a face mask. You can continue these things. You can continue 6-foot social distancing, wearing a face mask. So we will be patrolling all of the parks, urban park rangers, park monitors for active activity. What that means you cannot do is social gathering, groups together, convening together around certain areas, picnic tables, open space. We want you to keep moving. So if you do want to get out and celebrate the 4th of July and keep your recreational activity going, you can join Mayor Turner and myself for a 10-mile everyday jog or walk in the park. Is it 10 miles, Mayor? 10 miles. We do want to get out. We know the outdoor, the fresh air out there does you some good. Please wear your mask. Keep 6 foot apart and just keep moving. Thank you.
And some of us will be moving so fast you won't even be able to see us. But I will be out there moving. So please join. The main thing is that we won't be congregating, okay? We're not going to be fellowshipping in large groups in the parks. The parks will be open, but we want it to be a kinetic experience, which means you just keep going, keep moving, and keep yourself safe. So that's what that means. Having said that, let me pause and we'll take any questions that you all may have.
The medical center reporting today on their latest version of their dashboard that they're at 102% capacity, and also your own fire chief has been saying that it's been delaying response times. They're having to hold people in ambulances for over an hour. given all of that, and I'm sure you know more things internally, how concerned are you about our medical center, its ability to care for all Houstonians who need help, and what would you like to see more of from the people in power at the medical centers?
Well, I talked with several of the CEOs earlier today just to hear the latest information on their capacity. They're still indicating to me that they within their capacity limits today. Okay, that they are busy. They're saying that they still have room to surge within their respective hospitals. With the exception of the Harris Health Hospitals, LBJ and Ben Taub. They are pretty much at maximum capacity, and then they are spreading that load around. But with respect to the other hospitals, there's still capacity, but they all caution. They're within their abilities to provide a bed to people who need a bed for right now, but they are concerned about the rising numbers. And what I've indicated is that we all need to make sure that we're on the same page and we don't lull people into some sense of complacency or thinking that if people continue to behave as they're behaving right now, that 2 to 3 weeks from now that there will be a bed for them. They are raising concerns about that unless the behavior changes and people will engage in social distancing and wear their masks and proper hygiene, there could reach a point where they are really at their limit. But for right now, there are beds that are available, and they will be providing us those ongoing regular reports so that we can alert people to where things are. If we stay on the current path, okay, then we're going to be running into trouble. Let me just say that. If we stay on the current trajectory, because the numbers today, this week, over the last several weeks, are far worse than the numbers in March and April and May. So if we stay on the current trajectory, we are going to run into problems with capacity. And so that's why it's very important over the next couple of weeks, starting yesterday, that we work collectively to blunt the progression. That's why we are utilizing everything within our disposal tools to highlight, when people are not the bad actors, so to speak, or people when they're bringing people together. But we just need to be very, very mindful that we need to separate from one another and wear these masks. The wearing of masks is a must.
Can you talk about the contact tracing issue? Has that not been very fruitful, or has that been fruitful? Where is it in this?
It is fruitful, but when the numbers get up to let's say 5, 6, 7, 8, 900 a day, it becomes very difficult to reach out and touch that many people and then find out who they have been around. When you're dealing with around, let's say, 200 to 300, that's more of a practical number to work with. But when you start getting up to, like I reported today, over 800, and yesterday was 280, the day before was, I want to say, like 800 and 900, those are very high numbers, and you need thousands of people in order to contact trace. And so that's why we have to work hard, and we have to be very intentional to bring those daily numbers down, and then our contact tracing will be even more effective. So if we were dealing with the numbers that we had in April, May, yes, contact tracing would have been very effective. Dealing with the numbers that we're facing with now, it becomes a lot more difficult, and you need thousands or more contact tracing in order for that to be effective. It's just a strain on the overall system. The infrastructure is not built out enough to sustain those type of numbers.
Mayor, in terms of the Texas Medical Center moving into phase 2 of ICU capacity, what role, if any, is the city playing in their contingency plans to make sure that there is bed space available for people who need it?
Well, our role, quite frankly, is on the messaging end. We are not, in terms of providing additional beds or space, that is not what we are doing. Our role is on the messaging end. Our role, for example, is suspending all city-sponsored, permitted, and produced events for the month of July. That's our role. Doing everything we can outside of the walls of the hospital to try to slow and blunt the progression of this virus. With respect to inside the, excuse me, inside the walls of the hospital, we don't have a role. In terms of setting up temporary hospitals, for example, or providing temporary beds, that is not something that the city does. That's more of a question for the county and not for the city.
In terms of reopening and where we are, would you like to see reopening rolled back even more? Have you had any conversations with Governor Abbott about possibly reversing?
Yes, I've sent a letter to the governor along with, I've sent a letter, the mayors of San Antonio, Austin have sent a letter, for example, in terms of rolling back, even as it relates, for example, to gyms and bowling alleys.
And where does that discussion stand right now, today, at this hour?
I would imagine it's before the governor for him to make the final decision. It's the governor's call. It's not my call.
Did he give you any indication on when you may hear back in terms of what his plans are? And if he'll give local entities, local municipalities, the power to do what you just said?
I can't. Right now, we don't have that authority. I can't say to you whether or not he's going to give us that authority. There's been no word that he's going to. I don't know. I don't know the answer. Several mayors across the state have written letters to the governor asking for a return of our authority. Whether or not he intends to do that, I do not know. I did hear on one channel last night that he was concerned that when local governments had the authority or were given that authority, he did not want anybody to be jailed or anything like that. So let me be very, very clear. We are not talking about jailing anyone. We have never talked about jailing anyone. We don't fine anyone. We educate and make people aware. But we have asked for the restoration of the authority that we had in March or April. Whether or not that's going to take place, I don't know.
Thank you, Mayor.
Surely.
Mayor, regarding the state GOP convention over here,
Yes.
Are you in communication currently with the state leadership of the GOP about the convention? Are you? They're going to be making a decision very soon about how to proceed with their convention. Are you communicating with them and offering your opinion?
Yes, I will tell you that I have had a couple of calls from people affiliated with the state level. I guess you could asking about my opinion and what I intended to do. And what I've said to them is that this is a political convention. It is the state Republican convention. I don't want anyone, I don't want to politicize this issue. If it were, for example, any other convention, it would not be proceeding. I certainly would take steps to say no, okay, as I have done on other events in the city of Houston, as you all know. When it comes, there's nothing more sensitive than the Houston Livestock Show and Rodeo. With respect to the Republican State Convention, I strongly believe it should be a virtual experience. I strongly believe it should not take place, okay? But it's the Republican State Convention. You have the governor, the lieutenant governor, statewide officials. You've got State Senator Betancourt from Houston. All of these individuals are members of the state Republican State Convention. Why should I police their convention? They are more influential with their delegates, with their party, than I am. If I do it, then people can easily say, here's this quote-unquote Democratic mayor shutting down a Republican convention. I don't want to politicize it. I don't want to politicize it. And I would like to think that people would put the health of the delegates and the health of the city and the respective cities that these delegates will be coming from and going to ahead of anything else. If I were in their party, and if I held an influential position in their party, I would say, do not go through with this convention. If it were the Democratic convention, okay, and when I knew it wasn't going to be politicized because, quite frankly, I'm a Democrat, it would not be proceeding. Okay? But I am, as I said to people who call me confidentially, I choose not to be used in this situation. So that's my response.
Are you trying to do anything?
I think it should be a virtual experience.
Are you trying to do any kind of influencing if they do proceed? Is the city trying to do any kind of influencing on their safety protocols?
Yeah, let me just encourage people. Let me do this. With all due respect to the media, with all due respect, do y'all have the number to the governor? Do y'all have an email address? Because if y'all don't, I could give you that. Come on now. It's not my convention.
Mayor Turner,
No, it was about the same subject.
I want to follow up on that and then relate it to. Yes, we are going to move on. We are going to move on. And it's my question. I want to follow up on that. You said that if it was a democratic convention, you could actually bring in your leadership powers to stop it. So it means that politically, and as a political meeting, it could be stopped. But there is also the capacity issue of certain buildings not holding more than a certain number of people. Now, we are talking about the life of expatriates, diplomats, people from different parts of the world who are here, whose lives may be compromised, who may be victims of the coronavirus, because we are playing politics. If the governor doesn't come in to stop a Republican convention, that may affect the lives of the people. If we are having these coronavirus statistics and data rising every day as we are having, and the convention supersedes the public health of the people, something is wrong. But I respect your right to say that it's a political issue and you will not appreciate that. So the question is, how far do we go with this? Because other political meetings are coming. When will that stop? When will the health of the people be considered first?
Well, I think your questions and your statements are quite appropriate, and I would recommend that you pose those questions to people that are part of the conference, of the convention. I think they are the best people in the position to answer that. But I choose not. I think I've said as much as I need to say on that issue, and my answers speak for themselves. Okay?
Adjustment, I'm sorry. In regards to the park closure, in order to safely and successfully do the 4th of July fireworks, we will be closing Sam Houston Park and Eleanor Tinsley Park on Saturday. Those parks will be closed completely in order to safely put off the 4th of July show, which I encourage all of y'all to watch. Thank you.
All right. Thank you all, and enjoy the rest of your day. Thank you.